So I've been at ERC Far West for about 14 years, just down the street. I'm a family medicine doctor. And one of the reasons I went into family medicine is to be able to get to know people and talk to people. And for the most part, listen to people, because I think that's sometimes one of the most enjoyable things in the way you connect with people. I'm discussing the doctor-patient communication and relationships, and also how to talk with your doctor. And it's going to be kind of in two parts. The first part is going to be about the barriers to talking to your doctor, and there are several barriers that you have nothing to do with, but they're still there nonetheless. And then secondly, I'll hope to give you some practical tips on how to improve that communication with your doctor. So just to get into it, the first barrier that I can, and you probably can figure this out, doctors are pretty distracted. They're real busy. They're answering prescriptions, and they're writing prescriptions, they're answering phone notes, they're seeing multiple patients, they're doing labs, blah, blah, blah. You know, they have all their worries and concerns, and in some ways it has nothing to do with you. But unfortunately that impacts the ability for the doctor to listen to you sometimes. They could be too busy that day for whatever reason. And so to make it hard to talk to the doctor, to make it as easy as possible to communicate with the doctor is probably one of the things that you can do to make it better, and we'll get to that. The second thing I would say is that doctors in general, we're not taught in medical school how to listen or how to communicate. There's no course on that. There's nothing we have to pass. Some are better than others, and I think most of the time it's because they took their own initiative to learn how to do that better. But for some people, they're just not very good at it. And that doesn't mean that the doctor's not good, but it does mean it'll be harder potentially for you to sort of come to an understanding, and for them to listen to you and understand kind of where you're coming from. So you may have to do a little extra work to try to get your point across. So those are, and then the third barrier I was going to say is that doctors are, and this may be a news flash, but doctors are people, and they are definitely are prone to having good days and bad days, and good visits and bad visits. One visit after another. One visit can be great, the next visit not so good, as far as connections go. So I think that again, is not something in your control, but it affects your visit. And you have that span of time, 10 to 15 minutes, to try to get a point across. So you want to do everything you can to try to address your concerns. And I think the problem with that is that one of the most important parts of a doctor-patient interaction is what you tell us, is the history. We're taught in medical school that 90% of problems can be diagnosed by history. So if you can communicate that well enough to us, then we can probably figure most things out. If that's not communicated well for whatever reason, and sometimes it's there's just two people and the communication just doesn't work out, then the diagnosis, the whole plan, it can all just fall apart. It's just missed. So I think the communication between the patient and the doctor is, that's probably the most important thing. More important than labs and more important than x-rays. So that's something just to keep in mind. So this is the kind of the things that you can do, and I've kind of entitled it, How to Become an Assertive Patient. In the past, I think doctor-patient relationships are considered paternalistic. Patients mostly had a passive role. The doctors would ask patients questions, the doctor would make a diagnosis, the doctor would prescribe a treatment, and that was the end of the visit. There wasn't much back and forth, there wasn't much communication or talking. And that's how it was done, and then some people grew up like that, and that's kind of what you expect. But that's not the optimal way, in my opinion, to do it, and I think it's changed now, where the doctor-patient relationship is more collaborative. They'll use the word patient-centered, and this part of this is the doctor has to make that effort, but I think the patient should understand that this is where things are going, and this is kind of how it should be approached. And by that I mean the patient should share concerns about the diagnosis and the plan, and sort of to some degree come to an understanding and agreement that this is the direction that you want to go in. Now, you don't have to understand exactly what's happening with the treatment, but you need to understand that, well, I'm taking this because of this, a very basic understanding, but all the science and stuff, obviously, you're not going to necessarily know. So again, how to become a more assertive patient. So one of the first things you can do is, and this is part of the handout here, you can just know your history. Just know what your past medical problems are, your past surgical problems, your medications, your allergies. I find it helpful when people know what medicines they've taken in the past, even antibiotics or blood pressure medicines or antidepressants that haven't worked, because then we don't kind of go back and use something you've used already. So if you know exactly what you took and what dose, that actually helps. I have patients that come in with usually one page of all their history and stuff, and that's helpful for me. Sometimes it's more than one page, and that's okay, But as long as if you can bring that in written, that will help. The second thing I would say is you do want to prioritize your concerns. Usually I say, tell me what your most important problems are. Sometimes people will come with a list of problems, and I'll go over that list and we'll come up with the most important problems. For me, the top 3 are usually kind of what we try to address. Trying to do more than 3 in my experience has been kind of hard to handle things thoroughly. If you have too many, it's just going to be hard to do within a visit. So you do want to think about what you want to address as opposed to what, I think, again, this is where you're going to have to figure out before the visit what are the things that I need to talk about. And maybe we could talk about your whole list of problems, but we won't get to all of them, and we'll have to figure out the plan for the rest of them. The third thing I wrote down here is to tell your story. So by that I mean you really want to put into a couple of sentences kind of what you think happened. So you tell what happened, when and how long it's been going on for, whether it's getting better or worse, and what medications you've tried. And an example of that would be like, I fell and twisted my knee while I was walking a week ago. My symptoms have worsened over the last week, and I tried some medications to get some relief, some ibuprofen. So there it tells you what happened and how long it's been, and whether it's getting better or worse. I think the better or worse part is really important too. Another example is I've had fever and cough for 3 days, and I feel like I'm getting worse. So just from that start, we probably have a direction in which to go. We'll know what to go. This is probably the hardest part of all this, is sharing what you're concerned about. So at the end of a visit or after doing the interview, I'll often ask the patient, is there anything that you're worried you may have? And sometimes, it'll be surprising to me what people are worried about. I had a patient that came in with pain on her chest. It was on her right side. She's young, she's healthy, she didn't smoke. But then when I asked her that question, she says, yeah, I'm worried I have cancer. And that's on the list of possibilities, but it's not really maybe the top one that I would think of. And then if you sort of dig a little bit deeper, you find out that her sister had lung cancer a year ago, was diagnosed, and so she's really worried about having that as well. And that's not unreasonable to have that kind of concern or fear. What happens sometimes is people say, I have chest pain on my right side, and they stop there, and then they go through the visit, the doctor says, okay, I think it's just something muscular, don't worry about it, take some ibuprofen, and then come back later if you still have problems. And I think the problem with that kind of visit is that your worry and fear and concern wasn't addressed. And when that happens, you go home both unsatisfied, but you also go home maybe not hearing what I said because you're thinking I still have lung cancer possibly. So I think, to get that out there is totally reasonable, and to not be afraid to share that. I mean, I think sometimes patients may be a little worried that, well, I don't know if this is the right thing or if I'm making it up. So I think just kind of whatever you're concerned about. I read on the internet, I Googled my symptoms, and so I think all those things that you may have found on your own that's running through your mind are all reasonable concerns to be addressed by the doctor. Let's see. So again, everyone has their own fears, and often it's based on some past experience, and those fears are real. They can definitely cause problems in terms of compliance with whatever plan we have because we're not addressing the fears. And then the last part I put here is expect a plan. So by that I mean, the questions that you should have answered are, well, what do I have? What is the diagnosis? What is the treatment? And sometimes it's also going to be, what are the options for treatment? What to expect? Well, what happens when I take this medicine or do this treatment? And then what symptoms do you need to follow up for? And then also, finally, what is the backup plan in case this doesn't work? So there's a lot of different parts to the end of the visit that should be addressed instead of take this and just call me later if it doesn't work. And again, another example is I'll tell patients, you have pneumonia, I'm prescribing a Z-Pak, which is an antibiotic. I expect you to feel better in 2 to 3 days. If you still have fever after 2 days, then I need you to follow up and we need to think about doing a chest x-ray. So they'll cover all the potential parts of the plan and also come up with a backup plan. Again, another example is you have arthritis of your knee. I think your options are medicines or an injection or a referral to an orthopedic doctor. Kind of what do you want to do? And then if they choose a certain option, then I'll give them also kind of what to expect after doing that option. So again, I think the plan part sometimes isn't clear when people leave the office, and that's not really good. I mean, I think you should know what people think, what the doctor thinks you have, and then also know what the treatment plan and the expectations of that treatment. So that's that's really kind of all I have to say about talking to your doctor. If y'all have any questions, any questions about anything I've said, and I'm happy to answer any questions that I can answer. Yes?
Do doctors feel a little threatened if you go on the internet and Google things?
Okay, so the question is, do doctors feel threatened by patients that come in with stuff they read on the internet or Googled? I personally don't feel threatened. I'm always curious to find what you Googled, you know. I'll also admit that sometimes you come in and you tell me, oh, I think I have this, and it wasn't on my list, but it's like, well, you know, that's a good point. That's reasonable. You know, I need to think about whether that's something that's possible. I think that we're so used to it now that I don't think they should feel threatened. And I think that it's expected. People Google everything, you know, and I think that's just kind of how life is now. And that said, I think if that's something that you've read, for good or bad, it's in your mind, you know, and you're wondering, do I have this? And I think if you kind of don't address it, then perhaps that can, you know, like hinder your ability to move on or understand the treatment that you're undergoing. So I think it's important, either way, whether they feel threatened or not, to try to bring it up and, you know, ask if this is something we have to worry about. Yeah. Any other questions or further questions about that?
Well, no, I was just thinking, every time I mention Dr. Oz, the doctors just roll their eyes.
Yeah.
They don't want to hear about it.
Okay, that's a good point. Yeah, so
you see it
That's different than Dr. Google.
yeah. Dr. Oz
is another thing.
So, and I think another thing you're bringing up is different kinds of treatment. So when people bring in alternative medicine type things, some people are more comfortable than others dealing with that. I don't know a lot about alternative medicine, but I know, especially with neuropathy, if it works, I'm all for it. You know, I would say, you know, acupuncture, if you found some kind of herbal medication or supplement that seems to help you, as long as I've not heard anything really negative about it and it seems to work, well, I think that's a reasonable way to approach your problem, especially with neuropathy. I mean, neuropathy, and I think I've said this before, I'm sorry you have neuropathy, there really isn't a great cure for that, and it impacts your life every day, every moment of the day. And so it's hard. And I think that, you know, like I was saying, if you find something that works, Western medicine does not have a lot of answers for that. Okay, yeah, the question is there ever a time when it would be appropriate to leave the current doctor you're seeing and find a new doctor? Yes. I think just like any relationship, you know, and certainly in no way is a doctor-patient relationship sacred, you know, I mean, it should be very held in high esteem, but you can break that bond if it doesn't work for you. There are doctors, just like any other service, they're like plumbers or, you know, mechanics, where it just doesn't work. And it's not to say that the doctor necessarily is a bad doctor, but it's not working for you. And by that, if you don't feel listened to, like the story that was told earlier, if you feel like you've tried several times, but you're not getting any results, it's reasonable to find a new doctor. And just by virtue of a different set of eyes looking at that problem, that person may just have an insight. The knowledge that doctors have, we have all unequal parts of knowledge. It's not like a computer. So one person might be better at figuring out your problem than another. So I think, and speaking as a doctor, I don't think if someone decided that they wanted to see somebody else because they felt I wasn't helping them, I would be fine with that. I would be say, yeah, go ahead and try to see if someone else can help you more. We've tried it here, and it just isn't helping you. I refer people to specialists all the time because of that. So I think that's definitely something reasonable to do, and well within a patient's even right to do. You should be able to get what you need from the doctor. Now that said, I will say that again, neuropathy is a very frustrating problem. You want to sort of find a solution to it. Sometimes you may find another doctor, but you're still in the same place. And that could be part of it too. But yeah, I would definitely encourage you to find someone that you're comfortable with that can help you. Yes.
So I want to thank Dr. Garcia for coming.
Yeah.